health system in KwaZulu-Natal is on the verge of collapse. The Democratic Nursing Organization of South Africa says people are dying on stretchers while waiting for beds. The union says there's no capacity to admit patients. eNCA's Tuba Vilanes spoke to the union's provincial secretary, Mandla Shabangu, outside of Wentworth Hospital.
The situation is getting out of control since the beginning of December. This hospital has been experiencing a lot of positive cases when it came to staff and patients, and you find that many healthcare workers are on isolation or quarantine, and there seems to be no plan of replacing those who are on quarantine. At some stage, you find that a ward full of 55 patients will be nursed by 2 nurses. And that is creating a serious strain because some of these patients, you find that they are positive, some are PUIs. They are just mixed all over because there is no capacity to hold either from human resource or from the staff that needs to be specifically dealing with positive cases. The situation is dire in this hospital. And you find that it seems like management is also confused. They don't know what to do because they seem not to have a plan of how to deal with the high rate of healthcare workers who are on isolation or quarantine. So those who are coming to work now, they feel strained because there's a high load of patients who are coming here without getting support from management. Nurses are really not coping in this hospital.
Last night, the president addressed the nation, and one of the things that was expected and indeed he touched on is the issue of vaccine. What is your view on the delays that the president spoke about on the issue of vaccine? Don't you think we should be prioritizing these healthcare workers that you're talking about here?
It is very disappointing to learn that the president is telling us about the second part of the year where they might be start distributing this vaccine, because to us, we think for a state to protect its healthcare workers should be a priority, because without these healthcare workers, the health system will collapse to its knees. Now, we are observing this attitude of the president and its administration that when it comes to healthcare workers, they seem to be taking a backseat in prioritizing their health. Instead, they keep on having this rhetoric that they are their heroes, they are our heroes, they are this and this, but their action does not show that. Because if the state was serious about protecting its healthcare workers, they should have done all the means to get the vaccine, especially to first give it to the healthcare workers so that the public can be assisted by people. Now you are finding a situation where there is no plan at all in dealing with the infections that are increasing on healthcare workers. But the same state is allowing patients to flock into hospitals without anyone assisting them. You find people dying on stretchers because they are waiting for beds. They cannot be assisted. There are no beds. There is no plan at all to deal with the issue of human resource which will assist our communities. We have a ground just down here in Clarewood. That stadium has been open, but there is no human resource to cater for those patients, so it is might as well not existing at all, because now patients are overflowing in this area. They are overflowing in Prince Msheni. At Prince Msheni, as I'm speaking to you now, all patients are rediverted now from all the private sector. They are coming to Prince Msheni and King Edward. Do we have capacity? The answer is no. There is no capacity at all.
Baba, very briefly, what are your plans in trying to engage the department? Have you tried to speak to the MEC or the leadership of the department in the province?
We have tried since last week the problem with the department is that they always want to hide behind being busy. Now, we have a situation where we keep on asking for their plan. A simple thing that, what is your plan on dealing with the second wave? We have not seen that plan. We keep on being told that there is a plan to deal with the second wave. But in our view, the department has no plan in managing the second wave. That is why you are finding so many healthcare workers being infected and so many are dying, but there is no plan to even replace those who have passed on. Those who are remaining behind are still expected to hold the fort. In the mix of the pandemic, they have not been given counseling, they have not been given their increment. The situation is bad.